Welcome to this presentation on negativistic personality, formerly known as passive-aggressive disorder. My name is Dr. TJ and my company is iMolecular. Passive-aggressive disorder is now negativistic personality. I will often hear people talking and they will say things such as, that person is so passive-aggressive. However, most don't really know what that means. As we're going to learn in just a minute, passive-aggressive personality disorder has been renamed to negativistic personality, and it's also been dropped as a disorder. So I'm hesitant to even use the word negativistic personality disorder because the DSM will no longer classify it as a personality disorder, which we'll learn about in just a minute. The connotation with the word negative may have us thinking that people who have this are negative, and there is a certain amount of truth to that. Yet let's not interpret what the disorder really is, although it's not really a disorder. Let's not misinterpret what it is and what it consists of. Let's first begin by discussing what personality disorders are. Personality disorders are groups of disorders where personality is maladaptive and disordered. And you might be scratching your head and thinking, what on earth does that mean? And that's a good question. This means that a person is having thoughts, feelings, emotions, or behaviors that deviate from the normal experience. And oftentimes these thoughts, feelings, behaviors, and emotions will interfere with day-to-day functioning, as well as occupation and relationships. The DSM-5 is the Diagnostic and Statistical Manual, and this is what we use to classify mental health disorders. We are on the 5th edition, and it is denoted with the Roman numeral 5. The DSM defines personality disorders as an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture, is pervasive and inflexible, and has onset in adolescence or early adulthood, is stable over time, and leads to distress or impairment. And as you will see, some of the features of this personality are inflexible, and often the cause of this disorder or these behaviors and features is rooted in childhood. As I was saying before, this is no longer classified by the DSM-5 as a personality disorder, yet there are obvious behaviors and emotions associated with the characteristic features that accompany the attitude and behavior that we will see with this personality. Negativistic personality is when a person has hostile, negative, or other types of harsh feelings toward a person or group of people, and instead of behaving in a hostile manner, they exhibit certain passive acts of behavior. Let's look at an example. Let's say your boss did something and it made you mad. Instead of getting angry or working things out with your boss, you decide to show up late for work or procrastinate on a project until the last minute to make your boss mad. Essentially, what's being done in this situation is the person is attempting to get even or get back at the boss for doing something that they didn't like. So they're not being overtly aggressive, they're being passive. Other features that we see here: stubbornness. They will often criticize and blame others and can be argumentative. They might have obstructive behavior and will defy or criticize authority. Procrastination is a feature. Feeling unappreciated is a feature. There will also be intentional negativity, an intentional delay in situations or failure to perform, intentionally resistant to completing tasks, personal or professional, intentionally forgetting things, and the fact that they're forgetting these things might actually lead to harm in certain situations. Again, they are being passive, but they are being passive in an aggressive manner that will lead to harm or hurt others. They will also exhibit aggressiveness and hostile behavior, and then they will follow up with being remorseful or penitent or acting like they're so sorry. Now, what are the causes? Now, with many disorders, we often have theories about the causes. Some theories are stronger than others. But with this personality, often it's rooted in childhood issues. Children may not have been properly nurtured. And for this reason, they might not have very good coping skills, and they might not know how to emotionally regulate. They might have lived in a household where parents were abusive or had substance abuse problems, used drugs or alcohol. And for this reason, they might not have had proper attachment. They might not have been able to bond with their parents or their primary caregivers. And they might also not have been able to form proper social relationships. And with many types of mental health problems, we can see sometimes imbalances in neurotransmitters or other disruptions in hormones in the body or other physiological or physical disruptions that can lead to mental health disorders. The best thing to do is have the person be assessed to find out the root cause of what is causing this personality. Now, treatment. Most people with this disorder, they don't think they have a problem, so they don't seek help, and it's hard to get them into therapy. However, we have standard treatment, which is cognitive behavioral therapy. And oftentimes, too, individuals might have other disorders such as anxiety or depression. And if that's the case, we can use medication. Also, they might have another personality disorder. And for some of those personality disorders, medication can be used. So it really just depends on the situation. I hope that you enjoyed this presentation today on negativistic personality and that you learned a thing or two from the presentation. Thank you so much for watching.